Our next healthcare career is a definite possibility for someone who is curious and likes to use technology to diagnose the problem. Could a career in radiology be one for you? The team at LMH Health uses a little bit of detection and a whole lot of technology to show us what this healthcare career has to offer.
Hi, my name is Haley Honeyman. I work at LMH Health as an X-ray tech. I work closely with a lot of different individuals. I work through the ER, through inpatients, through outpatients. We use live X-ray, we use flat plain films. We work closely with trauma patients, work with surgery patients. We see the simplest to some of the more complicated stuff, and that's what I like. We get to go upstairs. We're part of all over the hospital. In surgery, we run machines over there, so we're all over the place. Get to see a little bit of everything. I started out as a CNA, going into healthcare, worked home health and in a long-term care facility. I applied for Washburn using a high school diploma with a little bit of healthcare background. Got accepted into the program. It's a 2-year program. I did my clinicals here at LMH and worked in the imaging support specialist in the front office. Then I stepped up as a student tech in the X-ray department and fell into a tech position full-time. I've always thought that shadowing is a great avenue to go in healthcare. It's hard to see, of course you can talk to somebody and kind of get an overall standpoint of how things work, but going in you can actually see, wow, they're really running around, or they don't really do much at all. I thought it was going to be more than that. So you can see the different aspects of the hospital they're going into. Shadowing can really, even just 4 hours, it doesn't seem that long, but you can see a lot of different things in 4 hours.
My name is Andrew Schenk, and I am a CT technologist. A CT is essentially a fancy X-ray. It uses the exact same type of energy as when you get a chest X-ray or an X-ray of your hand or whatever. The energy and the science is exactly the same. A CT scan CT scan uses higher doses of radiation and is a longer exposure time to allow for a more detailed image of the anatomy. If it has blood flow, we can CT it. From head to toe, we can do it all. So I think CT really allows some creativity. There's no wrong way to get to the end product as far as the image, whether it's an X-ray or CT. You can kind of do the same thing multiple different ways, however you like to do it best. Or as the situation requires you to get it done, whether it's patient condition or pathology that you're trying to, image. There's no wrong way to do it as long as at the end of it, your images look the way the radiologist wants to see them. Patients can be great, patients can be difficult, you kind of run everywhere in between. But I've found the quicker that you're able to make a connection with a patient, the easier it is for me to get my job done. If somebody is seeing me, they're probably not having a very good day. If I can make the 5 or 10, 15 minutes, whatever I happen to see that patient, if I can make that time of their day better, then I've done what I can do.
My name is Taylor Ketron. I'm an MRI technologist at LMH Health. I work just primarily in MRI imaging. Just me and one other tech. It's a very small image modality. We don't work with many people. We scan ER patients, inpatients, outpatients daily, whether it's for like soft tissue, anything like that, using a magnetic field. So you have to start with a 2-year program for radiologic technologists, so X-ray, and then you kind of have a basis of if you want to specialize, you can. You just have to start with that 2-year. X-ray wasn't exactly what I thought it would be. It's very fast-paced, and I just knew I wanted something a little bit slower, but still, on my feet with people. I like the fact that there's no radiation involved, and it's magnets, so it really just chose MRI because I liked that, and then also the pictures itself, it's very detailed. So as far as you really see inside the body, and it's just pretty cool to see. So I feel pretty lucky in the fact that I'll always have a job. I mean, I don't see this going anywhere. So I feel as far as demand-wise, I'll always be needed. The pay is very nice. There's always something new to see. And like I said, since it's so detailed inside the anatomy, nobody's the same, so you're kind of like figuring things out. So if you're, like I said, a curious person, definitely look forward into it.
My name's Judd Batchelor. I'm a nuclear medicine tech at LMH Health. In nuclear med, we study the physiology of a patient's organs. So instead of looking at just the structure, anatomy of a patient or the organs, we look at the function of all those organs. So we're not seeing necessarily a beautiful picture of a skeleton or a beautiful picture of a heart. We're looking at the function of that heart, how well it's beating. The bones, we're looking at the blood flow to the bones to see if there's increased blood flow to certain areas, which could be indicative of the bone trying to heal itself in some way. Every job you have has its same routines, but I think in healthcare especially, you see every kind of patient out there, from little toddlers all the way up to centenarians, and so you experience all kinds of backgrounds, cultures. It's pretty cool, and then the technology is just advancing so fast, so rapidly in healthcare that it's pretty neat what's coming down the pipe for nuclear medicine, but also for CT and ultrasound and MR and diagnostic. It's pretty amazing. That'd be my biggest advice. Don't look at just one field. Don't think if you're interested in X-ray, look at X-ray, go follow somebody around in X-ray, go talk to a radiologist, one of the doctors that read those studies. But then also look at ultrasound or go look at MRI. And so that'd be my biggest advice, is actually come in and see what we do and kind of follow us around, and then look at multiple modalities.
A lot of radiology is the techs, they prep everything, do all the positioning and everything, and then set the machine up, and then the machine does the scan. Patient's out the door. And with ultrasound, we have our machines, but our arms and brains are essentially the machine, because we have to try to figure things out, find things. If I don't see a mass on somebody's liver and they haven't had any other imaging, then the doctor doesn't see it, and then the patient they don't know that they have a mass in the liver. So I feel like there's a lot of responsibility, and I like trying to figure things out. So that's the main thing I like about it. But it's a little easier to get into programs now. There's more programs out there. If you, like, people straight out of high school can get in now with no background. They do like to see that you have observed. So most hospitals will let new students, high school students, observe for 4 hours a day here and there, or maybe an anatomy and physiology class, things like that, and then you just apply to a program. Some people do really good in school and they get out in clinicals and they just don't have that, and it happens. And some people who don't do quite as good in school are great sonographers because they have that hand-eye coordination. It takes a lot of that to kind of know what you're doing. So yeah, don't have to get straight A's. If you can scan, that's the important thing. I think the best thing to do is shadow. It's we do it here at LMH, but most places you contact the HR department and they can set you up to shadow ultrasound. Most of the time they'll do it like 4 hours at a time, but I think that's the best way, because not only does it do programs like to see that you've done that if you do apply, but it also gets you kind of you can follow us around, watch us scan patients, see what we do, and see if that's something that you're interested in or not. Because I mean, MRI, CT, ultrasound, nuke med, they're all really good fields, and each is just a little bit different. So, but I think shadowing's the best way to go.
I want to welcome our radiology technologist panel to answer questions about career opportunities in radiology. Joining us this morning from LMH Health are Carly Bartusio, Andrew Shank, and Melanie Judd. Good morning.
Good morning.
Well, first question I have for you is, how do you collaborate with other healthcare professionals on your team?
We really, our team, and really hospital-wide, I work with 2 to 4 people in our department at a time usually. And it really takes a lot of communication within our team to get done what we need to get done. But aside from the communication within our own team, it takes a lot of communication with pretty much every department within the hospital. We have to communicate with the ER department, with doctors, with nurses up on the floor, with doctors and nurses and other doctors' offices and physicians' offices. So really communication is really one of the most important parts of our job and what we do every day.
So what kind of diagnostic tests do you perform as a radiology technologist?
If a patient were to present in the ER with abdominal pain, they would see multiple modalities. They could visit, nuclear medicine for gallbladder studies. They could come to diagnostic imaging for abdominal films. They may visit CT for a scan, more in-depth imaging. They could visit ultrasound as well. It would depend on, what we're trying to diagnose. And we play a key role in how that patient will be cared for while they are at the facility.
Well, I know during your video, we were getting a lot of questions coming in from students throughout the state on our chat. So if you haven't posted a question or comment, please do use the chat. But now I wanted to turn it over to Jaron to see if we could get some of those questions from students answered. Jaron?
Yeah, you bet. So, good morning, everyone. A few questions coming in. First, I know this was mentioned a little in the video about maybe starting out with a 2-year degree, but then there's all these other modalities that you can get certificates in. So, would you be able to share? We had a question about how much time then does that all take, really from start to finish, or maybe each certificate if a student wanted to pursue that kind of specialization?
So I'll take that one. I did, had 2 years of undergrad. Actually, I had a bachelor's before I started, but did my 2 years of basic X-ray school. And then I actually got very fortunate that there was a position open in CT here with LMH. Before I finished X-ray school, I actually got hired into CT before I finished X-ray school. So I was able to do on-the-job training and become board certified in CT without having to go to another educational program. Doing another educational program within CT is definitely an option and generally takes about a year. But I was also fortunate enough to again be able to do on-the-job training and earn my CT certification.
I do think that that's one of the really neat things about radiology and radiology programs in Kansas is I did a lot of my undergrad while I was still in high school. So I kind of had a head start on getting into the program. It only took me a year of college to finish the prerequisites that I need. And then I started in the program. And I think one of the neat things about radiology is I started with X-ray. I liked the pace, but at any time I could further my education and go into a modality like Andrew did or like what Carly did. Or you could add on a bachelor's degree with that for administration or management so that could be something you could fall back on or move towards in the future too.
And as Jason said in the video, there are some programs that you don't need that X-ray component first. Ultrasound and nuclear medicine are two of those. There are also modalities that you cannot cross-train from X-ray into. So nuclear medicine, you have to go through a program for, but CT and MRI for sure. A lot of hospitals are still cross-training X-ray techs to do those.
Well, great. Thank you. That's really helpful. The next one we got from Sydney. What was it like starting out in the radiology field?
The first year of the program is a learning curve. What you learn in the school setting is not always paired with what you're seeing and doing in the clinical setting. So sometimes that hands-on learning is really important for students to, hit the ground running in that clinical setting and just adjust to it.
Any other experiences, Carly or Andrew, you have to share about your time starting out?
So I actually have a bachelor's degree in music and then decided to switch my path and went to X-ray school. And I started out working in the front desk at LMH, learning the scheduling piece while doing clinicals at LMH. I fell in love with nuclear medicine during one of my rotations through our different modalities. When you're in the program, you get to pick 2 to 3 modalities to spend some time in and get to learn. And so during that time, I really enjoyed nuclear medicine, so I went on and did that. That's a full year program, 40 hours a week for 12 months. So it's essentially a full-time job. You can work in addition to that, and I did work, but it is a tough year, but it's well worth it.
Great. Well, thank you. Next, for each of you, is there a typically followed schedule or does it change from day to day?
It changes from day to day. Andrew can probably speak more to like a solid schedule. As far as diagnostic goes, we take on anything that comes our way. We are, assisting walk-in outpatients for care. We handle the ER, we handle the OR, we handle inpatients. So our schedule is always fluctuating.
I would say similarly, we're very similar in CT. When I show up in the morning, we have our schedule of outpatients that we know that we're, supposed to be getting that day, but our day changes really on a minute by minute basis. Doctors' offices can call and say, hey, we have this patient that is really sick, we need to get him in right away. The same goes with really anywhere in the hospital. We get patients, added onto our schedule on a fairly, not constant basis, but our day changes every 15 minutes probably. So
in nuclear medicine, it's more scheduled. We have less add-on patients. You have to have an isotope ordered, which usually comes from an off-site facility. Ours come from Kansas City, so it's not something that we can add on quickly. So most of our patients are scheduled, although we do have occasional add-ons, but we end up scheduling them at some point in the day to acquire the dose in time.
And then I think we have time for one final question. If each of you have a moment to share, what is the most challenge, or excuse me, we want to do this one. What is the weirdest or coolest thing you have seen in your job?
I'll start with that one. I actually had one of my more interesting experiences a couple weeks ago. So in CT, we do biopsies on patients using CT guidance and the radiologist assistant. And so, well, let me go back and not violate HIPAA. I had a very interesting biopsy case that really, one of those ones where going into it, everyone knew that it was going to be a challenging situation. And biopsies are interesting. It's one that we really work very closely with the radiologist. So we had a very sensitive spot that we had to try and get to and avoid some pretty critical anatomy and arterial blood flow. And throughout the procedure, it went perfectly, it went great, but it was definitely one of the more stressful biopsies I've been involved in, and that was just a couple weeks ago.
I think with diagnostic, it's more frequent that we see things that are out of the norm. Car accidents, fireworks, the ice recently, we saw some breaks that were not the norm that you would see. So, it's different all the time, but it's always interesting, which makes it fun.
I think one of the coolest things as well is, especially in nuclear medicine, we're imaging one part of the body, but we do see glimpses of other parts. And in any modality, there's something called incidental findings. And so there was a study I was looking at the heart, but noticed that the spleen was extremely large and not what you typically see. And come to find out, we were able to diagnose this patient with lymphoma, and they had no idea that they had it. So it's really important for our techs to know and look at the whole picture, not just that one thing that the study is ordered for, but to be aware of the entire person and the entire picture we're getting.